Okay, so currently alternative medicines are not covered under Alberta healthcare. Much like chiropractor, trip to chiropractor, wouldn't be as well. Should they be? Is this something that the Alberta Health Services really needs to take a harder look at and consider maybe offering a bit of coverage for people?
You want to take that?
Surprisingly, I would say no.
Okay.
I would.
That is surprising, sure.
Yeah, I really feel that if they were holding my purse strings, they would be able to control how I practice. And that the way that we practice, one of the things that makes it very special is that we have that time to visit with the patient, to understand and operate in that manner rather than cutting it for reasons of efficiency. And I said earlier, and I really believe it's not a we versus they.
No.
And that we want the best from all our practitioners. But if somebody was to cut my time back, it would restrict how well I practice.
Yeah, I can see that, sure.
In extension to that, if you were to go and poll sort of a lot of medical doctors, right, front lines, and say, are you happy with the way you practice and what you're being given? A lot of them would like to practice differently, right? It's nice to be able to have the time to sort of, like he alluded to, spend with people and get to know them. And
anybody who's been to a medical clinic can tell you, sure, you're in and out.
Right, one symptom, you're in and out, and the majority would tell you, yeah, I mean, the only reason I got to do that is because I've got to pay rent, and not everybody wants to practice that way. Mm-hmm. And so that's part of the reason too, with sort of the system is just harder to get into, right? There are fewer family doctors. It's a growing population, at least here in town, so it's harder to get in. And then so people naturally start to look for other options while they're in the queue or maybe still in limbo, at least in regards to resolution of their concerns. Mm-hmm. And we get them.
Mm-hmm. Mm-hmm. I see. I can't help but think people are getting a little bit tired of you have an ailment, you go to the doctor, the medical clinic, whatever it might be, you're given a prescription, you get it filled, it may, it's not covered, you're paying out of pocket unless you've got, a drug plan with work, which, let's be honest, a lot of people, don't unfortunately have the benefit of. Mm-hmm. Are people, and then, maybe they're cured, maybe they're feeling better in a week or two, maybe they're not, though. So I can't help but wonder, I mean, are people losing a little bit of faith in conventional medicine, specifically pharmaceuticals? Is that a fair statement, or am I a bit off the mark on that?
I feel they are, at least as far as the pharmaceutical. I think as far as the medical system, it's more a frustration around access, mm-hmm. right? Not so much the system has let them down. It's just, well, how do I really get in there and navigate through it? Because people have now needed to effectively be their own advocates.
9 months for an MRI,
right? It's a long time, right? Get into the specialist. Pharmaceuticals, I think, are a different story, and just I sort of feel personally what I've sort of seen in my practice is a lot of it is what's coming out now in the news, as far as, like we had mentioned, antibiotic resistant organisms, or what are we starting to find out about how animals are treated and their effect on their needing to be medicated, like chickens or cows, and what we're eating, and how crops are grown and sprayed, and how that's sort of, some of that's now started to affect sort of hormone balance within the body, and so more of this information gets out there, and people are becoming a little more thoughtful about what not only they might pursue as far as healthcare, but even what they ingest and how they choose to vote with their pocketbook.
Mm-hmm, mm-hmm. Also, there's been a lot of publicity with regards to pharmaceuticals as far as the business end, and I think I can't help but think that some people are under the impression that the business side of the pharmaceutical industry has actually eclipsed the therapeutic side. You look at people like Martin Shkreli, who was a man that was obviously a household name for maybe a couple weeks. So this is a gentleman who took a drug that was, of course, used by millions of people, I think, in the treatment of HIV, and skyrocketed the price. Lately, we've, of course, seen the increase of price when it comes to the EpiPen. Is this driving people away? Are people getting a little frustrated with that? I mean, personally, I hear that stuff and I think that's disgusting. I mean, pharmaceuticals are there to help us. The business end needs to be reeled in my opinion.
Yeah, but that's a business problem and a business ethics problem. It's not a pharmaceutical problem. The guy's a slimy businessman. Sure. That doesn't mean that the pharmaceuticals are bad or are not, but the way that business is run certainly needs to be revisited.
What about the belief that you take this pill and it's going to lead to these side effects, so you're going to need to take these pills, which we also happen to manufacture under our umbrella of products?
Well, the cynical person, which I may be at times, would say yes.
Likewise, sure. Yeah.
Why am I taking 3 more pills to deal with something caused by the first one? Mm-hmm. And it may be that the first one is not effective in curing, but managing the symptoms.
Yeah.
So if that's the goal, is to manage the symptoms, that product may be just fine. But if you want to get so that you don't need it, you would probably have to look farther than simply taking the medication.
Mm-hmm.
Lifestyle,
sure.
nutrition, herbs. There are many options.
So Eric, do you see a lot of people come into your practice and essentially say just that? Look, I'm on this pill, this pill, this pill. Help me get off this stuff. What's the plan?
Yeah, and it's not so much, you know, if there was a time frame for the taking the medication, but they'll come in and they'll say, well, I've been told I have to be on this for the rest of my life, right? Or I haven't been told how long, and I've been taking it for 4 years now. Yeah. And there's some frustration and concern around that, right? Sure. And especially with the, you know, the information coming out around potential side effects, or, you know, polypharmacy, which is sort of being on multiple medications and potentially having interactions that we're unaware of. So yeah, quite frequently we'll get people coming in and saying, either I have a symptom and this is a medication, I don't want to take it, or, you know what, I'm getting these symptoms from the medication, my family doctor hasn't had the time or the ability to deal with it. Can we work through this? Yeah. You know, and we are, and I'm in no position to sort of take someone on or off any medication. I didn't prescribe it, that's not my to do. No, but enough, what you find is in supporting people, just their body in general, they find they don't have the need. The symptom dissipates, they have less need for the medication, and it sort of just naturally will wean.
Yeah, and this is what blows my mind. I mean, if people want to give something a shot, by all means, give it a shot. If you're feeling better, it's working, roll with it. But yet we still have this element of people that are staunchly against the use of alternative medicine. Why? Why is that? It's a tough question. I mean, you're not getting into the head of millions of people, but you know it exists. I think you know what I mean.
Well, again, and that puts you in the position of criticizing people, you know, or.
Well, but is it frustrating? It must be frustrating.
Ignorance in the true definition of the word. They don't know anything about it, therefore they are going to not support it. And an extension
it begs
of
the
that.
question then. I mean, is a PR battle getting lost? Because I mean, we talked off air earlier. Alternative medicines are huge in Asia and in parts of Europe. Why the bit of a different mentality here in North America, do you think?
You know, I think
why do they need to be separate?
Yeah, I mean, they don't need to be, right? They would definitely work well together.
Sure.
I mean, part of it is, you know, what's come out from the medical establishment, you know, and there's a history of sort of, you know, well, quackery, and it's not evidence-based or double-blind, placebo-controlled, or what have you, which is sort of another topic. And like, you know, again, Dr. Clausen mentioned is just, you know, oftentimes what you don't know, you're a little sort of skeptical or unsure of. To a certain degree, it's a little unsettling to someone's model or paradigm, right? If you go and you accept something entirely different, it can rock your world a little bit, and some people aren't ready to have that happen, right? They get there when they do.
Fair enough, fair enough. We're gonna jump to another break, guys. Folks, stay with us. We'll be right back.